You are trying to eat healthy foods, even taking supplements like omega 3 and also trying to avoid sugar. But your inflammation levels continue to be high. And you might be wondering, why is that so? My research revealed that there is a hidden trigger of inflammation that we are completely avoiding. And in several of my patients, that turned out to be the major reason why their inflammation was not getting better. And you might be surprised to know that it is a hidden bacteria inside your mouth. And before you think that you brush regularly and take care of your dental hygiene, well, research clearly associate the presence of this bacteria in people's mouth and systemic inflammation. In fact, research studies have associated this particular bacteria with several diseases, including heart diseases, blood pressure problems, autoimmune diseases like Hashimoto's disease, and even brain inflammation. And unfortunately, for several people, the overgrowth of this bacteria is hidden because it doesn't give them frank symptoms. But in today's video, I'm going to share with you three things. First, what is this bacteria and how is it linked to inflammation? Second, what are the warning signs that you might be ignoring that signifies the overgrowth of this bacteria? And the third thing, my exact doctor dental reset protocol that you can use easily to improve your dental hygiene and control this bacteria. And as a bonus tip at the end of the video, I'm going to share with you my exact 5-minute dental night routine that keeps my mouth healthy and also keeps my inflammation levels in check. Hi, I'm Dr. Anshul Gupta, a former Cleveland Clinic functional medicine physician from US. I help people improve their chronic diseases by making personalized functional medicine plans. Most people think the only role of our mouth is to chew our food that helps in digestion and breaking down our food. But new research studies are showing like how our gut has good and bad bacteria. Similarly, our mouth also has a microbiome of good and bad bacteria, which significantly impacts our overall health. And over here, I'm not talking about whether you have cavities or whether you have a bad tooth. I'm talking about these teeny tiny bacteria, which all of us have present in our mouth, but only when there is overgrowth of this bad bacteria that leads to this systemic inflammation. What scientists have figured out, there are certain strains of good bacteria. When they are present in your mouth, they keep your pH of your mouth balanced. As well as these good bacteria also affects the immune system of your body. On the other hand, when you have overgrowth of this particular bacteria, it turns your own immune system against your own body and starts chronic inflammation, which not only damages your gums, but also damages blood vessels as well as other parts of your body. And there is specifically one bacteria called Porphyromonas gingivalis, let's call it P. gingivalis, which majority of the studies have been associated with high amount of inflammation and several diseases. And before you think that you're using that antibacterial mouthwash that is killing this bacteria, you are completely wrong. In fact, when you use antibacterial mouthwashes for a very long amount of time, it not only kills the bad bacteria but also kills the good bacteria in your mouth and make your dental hygiene worse. It is similar to gut health. When you keep using those antibiotics again and again, they not only get rid of the bad bacteria but also damages the good bacteria and in the long run basis damages your gut. So that's the reason you have to rethink about the dental routine you are using so you safeguard the good bacteria, same time remove the bad bacteria and also keep your body healthy. And this is exactly what I'm going to share with you today. But before we move forward, it is very important for you to know how this particular bacteria is causing inflammation in your body and not only in your mouth. The first way is that these hidden bacteria starts making bacterial toxins. These bacterial toxins start a localized damage in your gums. And then after damaging your gums, they enter your bloodstream. And this is where these bacterial toxins start a chronic inflammation process. This is very similar to what happens in a leaky gut syndrome in a gut. And this is what I call as a leaky mouth syndrome. Now, the next question is that are there any particular symptoms in your mouth that might point towards the overgrowth of this bacteria? Let me share with you the few common symptoms that you might have. The very first symptom is that if your gums bleed when you brush or floss your teeth, that is the first sign or symptom of it. The second sign or symptom is that you often have bad breath and you have to continuously use mouthwash to control this bad breath. And the third sign or symptom is that in the last 5 to 10 years, if you are getting new root canals or new cavities formed in your mouth. And the last sign or symptom is that if you have plaque formation that you can visibly see on your teeth. So these are all warning signs or symptoms that there is overgrowth of this particular bacteria. But as I said, sometimes people do not have all the warning sign or symptoms. The only symptom could be high amount of inflammation. All right, now let me share with you the exact dental hygiene protocol that you need to follow to keep this bacteria at bay. Step one, let's start from the basics, is that make sure you are brushing your teeth at least twice a day, one in the morning and one before you go to bed. And when you are brushing, make sure you are cleaning between the teeth also, because these are the hidden places these bacteria often hide. Now, as a caution, never use hard brushes over here. That actually do more damage than good. Soft brushes are more than enough. You just need to make sure that these brushes reaches each and every place in your mouth, especially in between the gum line and your teeth. And along with brushing, if you add flossing at least once a day, then definitely that improves your dental hygiene. The second thing, after you are done brushing your teeth, make sure you scrape your tongue. The reason being, tongue also holds a lot of bacteria and also a lot of sulfur compounds which are responsible for bad breath. And you just need a gentle tongue scrape from back to front. Especially do it in the morning. This itself is going to improve your mouth health significantly. Third thing is that stop feeding the bad bacteria during the whole day. What that means is that the more sugary food, the more simple carbohydrate food you eat, the more it feeds the bad bacteria. So try to stay away from sugary food. And if you are eating sugary food, after you are eaten, make sure you rinse your mouth with plain water so that less amount of sugar reaches your bad bacteria. And then remember what I said about mouth washes. Unless your dentist recommended specifically to use antibacterial mouthwashes on the long-term basis, it is best to avoid them. In fact, some of the smaller research studies have linked the use of mouthwash with high blood pressure. So if you consistently have bad breath, then you need to look for the root cause of it, not just mask it by using the mouthwash. And the last thing over here is to feed good bacteria into your mouth. That is similarly like adding good bacteria to your gut by adding good probiotic supplementation. Now, there are two ways of doing probiotic supplementation. Either you can use a probiotic capsule which improves your gut health and in turn will also improve the good bacteria in your mouth. But make sure this probiotic is strong enough. A minimum 30 to 50 billion is needed to support both your gut and your mouth microbiome. And on top of that, you can now use localized probiotic rich toothpaste. Several companies are making that also. I have made a special probiotic which is 50 billion and has all the right probiotic strains to support not only your gut health but also your mouth health. The link will be in the description if you want to buy it. Alright, that's the dental routine you need to follow. But let me now share with you a quick nighttime dental routine that I use on the daily basis that has kept my mouth healthy and inflammation in check. Basically, before I go to bed, I brush my teeth and I use an interdental brush. An electric brush actually has worked really good for me because it helped me to reach places in my mouth which I was not able to reach before. And I use a very soft toothbrush. Before that, I was using a hard toothbrush and that was actually damaging my gums. So at least I will recommend you to switch over to a soft toothbrush. If you can get electric interdental brush, that is even better. And I make sure that I brush my teeth for at least 2 minutes. After I'm done brushing my teeth, then I use a tongue scraper and scrape my tongue from back to front. Just couple of times and that is enough. Again, I am very gentle with it, not harsh. And that's it. I don't use any antibacterial mouthwash because that was actually harming my good bacteria. And along with that, I also make sure that I take a 50 billion probiotic, which is a combination of bifidobacterium and lactobacillus. That is my simple nighttime dental hygiene routine that has kept my mouth healthy. So today I shared with you this hidden trigger, which surprisingly I found was a main reason of inflammation in several of my patients. So if you have that person, you have an autoimmune condition like Hashimoto's or rheumatoid arthritis, you have high inflammation levels, or you just want to be healthy, then paying attention to your dental hygiene is very important. And most importantly, it is very important to know it is not being harsh with your mouth. Just being gentle but persistent with your mouth regimen is what you need. I hope you like this video. If you do, please like and subscribe to my channel so you keep on getting these healthy tips in the future also. Also share this video with others who might benefit from it. Until next time, take care. Bye bye.